is time to take charge of your health and start taking preventative measures to avoid certain health conditions like type 2 diabetes.
Joining me now for more in the sponsored interview is Lucy Maurer, registered dietitian with University of Utah Health. And this topic actually hits close to home because diabetes runs in my family. I'm pre-diabetic, but there are things that we can do to change the course and really avoid this full-blown condition.
Yeah, absolutely. Thanks so much for having me. I think it's really important to first of all consider the fact that prediabetes is a condition where our blood sugars are elevated, but not quite at the point where we're diagnosed with type 2 diabetes. And being aware of that is really important so that we can take some steps to reduce our risk for developing type 2 diabetes.
So what can we do to prevent if we do have a family history or maybe a doctor has said, we're on the cusp, we need to take a look at this. What do we need to change?
Absolutely. I think first and foremost, it's also important to consider that it doesn't mean that it's inevitable that it will progress to type 2 diabetes, even if we have a family history or if we're diagnosed with prediabetes. What we want to do is think about lifestyle changes that are helpful to reduce that risk. So things like eating a balanced eating plan, okay? So lots of veggies, fruits, whole grains, lean proteins or plant-based proteins, and then really focusing on working towards at least 150 minutes of moderate intensity movement or physical activity.
Per week?
Per week.
Okay, and so when we're talking about these changes, I've been in and out of pre and not diabetic. Can these stick? What are the things that you would recommend in terms of lifestyle changes?
Absolutely. I think we want to make sustainable changes, so incrementally, small changes over time with what I said in regards to our eating patterns and movement and managing our stress accordingly. Now, if someone is kind of struggling with that on their own, it would be recommended to join a diabetes prevention program. That's a year-long program, and it's designed to help people be empowered to make these health-related changes and maintain them for the rest of their lives. So we would recommend going to uofuhealth.org/DPP, and this is where you can find information about different programs, registration, take a risk for your risk for prediabetes, take a test for that, and find out more information. So that's kind of the next step I would take.
I think there's a lot to learn about this that I didn't even know. So if you get diagnosed with prediabetes, it doesn't mean you will develop the full-blown thing. Yeah. If you do what you're saying right now, you get proactive, you take those measurements. Who is at risk more than others?
Individuals with a family history are certainly at risk. Being at a weight and a higher body mass index can sometimes put us at an increased risk for prediabetes. I think it's also important to note that that's not everything, right? So our food habits can dictate if we're at an increased risk for prediabetes, skipping meals, eating too often. So trying to find that balance is very, very important. And again, managing our stress, this can play a role as well. And that's a very important consideration.
What I found for me, and that works, is the network. There are resources available that you mentioned, and that can really boost your motivation of, here's the lifestyle, and I want to commit to that.
Absolutely.
When it comes to the food, the exercise, and the people you talk with. And there are things in place at U of U.
Absolutely. Yeah, I would start off by going to that website. So again, it's uofuhealth.org/DPP. And it's really interesting because, as I mentioned, you can take a test to assess your risk level, right? But ultimately, the most important thing, if you're uncertain about your risk, is to talk to your primary care physician and get screened, okay? 9 out of 10 adults that have prediabetes are unaware of it. And so that's the first step to take. And if you are at increased risk or you have prediabetes, enroll in one of these programs or schedule with a dietitian and we can kind of get you started.
9 in 10 who don't even know. That is huge.
Yeah.
So get that screening. It's worth it.
Yeah, exactly.
And the ramifications too, when you don't know, it can cause and lead to so many other issues like heart disease, other organ issues. So it is good to get tested, especially if you think and you're worried about it.
Absolutely.
Thank you, Lucy.
Thank you so much.
Thanks again to the University of Utah Health for sponsoring this interview.